you are watching News 9 Digital's Facebook Live with me, Amrita, and today we will be discussing a topic which relates to Bengaluru. Now, BBMP is under discussion to close down some of the COVID care centers right here in the city. So this is still under consideration, and so far none of the COVID care centers have actually shut down. But yes, that's an option that BBMP is currently discussing. And the reason behind this is what the BBMP states is because a lot of people, a lot of COVID-19 patients are opting for home isolation, especially those who are not critical, who have mild symptoms or are asymptomatic, and young people, they are opting for home isolation rather than institutional quarantine. And with this regard, the number of people getting enrolled at institutional quarantine is getting lower and lower. So with regards to this, we are being joined by Dr. Srinivas, the Secretary of Indian Medical Association right here in Karnataka, to speak to us about his opinions on this decision of the BBMP to shut down some of the COVID care centers, on whether it is a good or a bad decision. Dr. Srinivas, thank you for joining us on this live.
Yes, madam.
Sir, first and foremost, my question to you is, what is your opinion on the BBMP discussing this decision to close down some of the COVID care centers?
Madam, actually, a lot of rules are changing almost since beginning. Depends upon the convenience also, health department, they are doing this. But problem is, initially there was hospital quarantine. Almost all the positive cases, they were doing hospital quarantine. So at that time, what has happened? There was no beds. So a lot of all the hospitals, beds, it was full. Almost denied patients, they were not getting any beds that time. Then that they started starting this home quarantine. The reason main this is to get the beds for the denied patients. So house quarantine, what they are doing as usual, they are monitoring the temperature, they are monitoring the saturation, all whatever drugs they used to give in the hospitals also they started giving hospital drugs and all these things. Suppose any problem about extra symptoms and saturation and all, definitely they have to inform the concerned people, those patients to be admitted in the hospitals. So like that only is practicing now. Actually, COVID care centers also they are doing same this one, whatever they are doing, they also same thing they are also doing. So extra, and they may feel, I think BBMP people also they are feeling a little bit difficult to monitor that also. That mostly, that may be the reason why these things they started, and now they are planning to close these things. See, my idea, what my this one is, this one is they have to support the system of hospital management. Yes. And no patient should be denied of any ICU beds. Immediately they should get the ICU beds, and no, not a single time they should lack in any oxygen concentrations and all these things. They have to see that oxygen should be freely supplied to the hospitals, and drugs like injection remdesivir and all this also should be supplied.
Yes.
This is the most important supplying of remdesivir, supplying the oxygen, and maintenance of this ICU care, ventilator and all. These things, by keeping these things, definitely we can reduce the mortality, and especially old people, we can save them. Yes. This is the most important. Rather than COVID care centers, I don't think it does much behind compared to house quarantine.
Yes. So Dr. Srinivas, what you're trying to say over here is that the whatever money BBMP can save by closing down some of these COVID care centers, they can in fact take that money and also invest in some government hospitals to ramp up the facilities over there.
Yeah, yeah.
Okay, all right. Thank you so much, Dr. Srinivas, for speaking to us about this topic and giving us your valuable input. So right there, BBMP is also now mulling to shut down some COVID care centers. There is some good parts to it, to the decision and the discussion. We need to see in the future how this will all span out. Yes, in terms of numbers, the number of beds might come down because some of these COVID care centers might shut down if, yes, a BBMP goes through with this decision. But at the same time, they might also be able to focus the necessary resources in hospitalization where critical patients need it the most. Thank you for watching this Facebook Live. Also, leave your opinion in the comment section down below. Don't forget to like, share and subscribe to News 9 Digital.